Once a surgical date has been confirmed, there are several things you can do to prepare for a smooth and successful recovery. First, obtain access to the MyChart program. Second, a preoperative visit with our physician's assistant has likely already been scheduled. In addition, you will also undergo a pre-anesthesia visit at Cadlick Hospital and a prehabilitation visit at the Cadlick Healthplex. It may also be necessary for you to see your primary care provider if you have not seen one in the last 12 months. If you have significant cardiac issues requiring the care of a cardiologist, a letter from this physician may be required. There are a few useful items and pieces of equipment to obtain, and finally, there may be some medications to start before surgery. Obtaining access to the MyChart program is the most efficient way for you to communicate with our office both before and after surgery. You can obtain access by visiting this website or by scanning the QR code on your postcard provided to you in clinic. The MyChart program is also a way that we can send you surveys at certain points during your surgery process that will help us monitor your outcome from your perspective. Surveys will typically be sent to you prior to surgery, 6 weeks after surgery, and 1 year after surgery. It is very helpful to us for you to complete these surveys at home before your clinic visits. A preoperative visit with our physician's assistant, Kitrick Kane, has likely already been scheduled for you. If you do not know this date, please notify us and we will confirm that you have one scheduled. This visit is performed at the Northwest Orthopedics Clinic at 875 Swift Boulevard in Richland. It is an approximately 30-minute visit where a review of your medications and medical history will be completed. We will confirm with you your postoperative discharge plan and your support plan. We will also develop a personalized pain management plan and select an appropriate blood thinner for after surgery to help prevent blood clots. These medication prescriptions will be sent to the pharmacy adjacent to the hospital and will be delivered to your hospital room immediately prior to your discharge, so you or your family members will not need to worry about obtaining prescriptions after the discharge. A surgical consent will also be signed. We will also provide you with other prescriptions needed, such as a temporary disabled parking placard for a period of 3 months and a prescription for a walker if you have not already received one. This will also be a time for you to answer any additional questions. You should be prepared to answer the following questions at this visit. Do you or a close family member have a history of blood clots or pulmonary embolism? Do you have any intolerances to any specific pain medications, or have any pain medications worked well for you in the past? Do you have any known sensitivities to metal or nickel? Who will be helping you mostly after surgery? How far can you walk until pain becomes an issue? And what other treatments have you tried, such as medications, injections, or physical therapy? It is also helpful for us to know roughly when these treatments were attempted, such as within the last 6 months or more than a year ago, etc. You will also need to complete a pre-anesthesia visit. The hospital will call you to set up this appointment, and typically will occur 1 to 2 weeks prior to surgery. You will enter through the main entrance of the hospital across from the parking garage, and the staff will direct you to the location. At this visit, you will obtain blood work and other studies such as an EKG or a chest x-ray if necessary. An anesthesia provider will also perform a screen of your medical record for potential issues. It will also be very helpful for you to complete a prehabilitation visit. If this is your first surgery and not a revision or your second surgery, you will be called by Cadlick to schedule this visit. This is a one-on-one educational visit with a physical therapist who will teach you techniques to move safely and how to perform exercises after surgery. This visit will prepare you for a safe discharge and recovery. At this visit, you will also meet our nurse navigator, Syra Campbell. Syra will be your guide during the initial stages of recovery. If you have seen your primary care provider in the last 12 months and medical issues are well controlled and stable, then this should suffice. If you have more complex medical issues or have unresolved issues that need further evaluation, additional treatments, or optimization, then you may want to check in with your primary care provider prior to surgery. If there are significant unresolved issues, then surgery may need to be delayed. In addition, if you see a cardiologist routinely for heart issues, then it may be necessary for you to obtain a surgical clearance letter from that provider. A raised toilet seat and a shower chair are not required, but can be helpful, especially if your toilet is low. A standard front-wheel walker is required and is typically covered by insurance. The prescription will be provided to you, and you can pick up the walker prior to surgery at any medical supply store, and it can be left at home. A walker can also be dispensed while you are in the hospital prior to your discharge, but this can cause delays. If you are not currently taking vitamin D3 supplementation, a prescription has been sent to your pharmacy, and you can begin taking this now and continue taking this for at least 6 weeks after surgery. If you are not currently taking a stool softener or laxative for bowel issues, a prescription has been sent to your pharmacy. Constipation is a common issue after surgery due to the anesthesia and the narcotic use, and can be quite problematic. To avoid this, you can begin taking Senokot 1 to 2 weeks prior to surgery until you start having loose and regular bowel movements. In addition, if you have a history of constipation, you may want to begin a stronger laxative the week prior to surgery, such as Miralax or Milk of Magnesia. These medications should be discontinued if they are causing significant diarrhea. In addition, you can optimize your nutrition by maintaining a healthy diet, keeping well hydrated, and if you do not already do so, consider taking a multivitamin. You could also consider taking a daily protein supplement. If you are a diabetic, it is very important for you to maintain your blood glucose levels before and after surgery. If you have any questions regarding these items or additional concerns, please reach out to our team. The best way to communicate prior to surgery will be through the MyChart program. Messages will be forwarded to one of our medical assistants and will then be forwarded to the appropriate provider if they are unable to answer your question or address your concern. Many problems and complications can be avoided with proper planning. We need you to be committed to learning and following our instructions. The key to a safe, smooth, and successful recovery is preparation. In summary, what you need to do now is to attend your preoperative visits, wait for calls to schedule the pre-anesthesia and prehab visits, start taking medications if needed, and begin obtaining the desired equipment. Please review this video as many times as necessary to make sure you are ready. Thank you for listening.